Hi, I'm Joanne Ontiveros. I'm a physical therapist at Ventura County Medical Center. Today I'm going to be talking about developmentally appropriate toys for different ages. One of the things that have come up lately is parents wanting to know the best toys for their child, and also I try to explain how it stimulates the child and what areas. You really overall want to avoid a lot of screen time for any child. There are guidelines out on different sites, but for very young children under 3, you absolutely want to avoid screen time. Very young children do not need a lot of visually input on a screen or computer or even a phone. One of the things that you're working on initially is to stimulate the senses. So these are some toys that I'm going to explain of why it's so important to start stimulating the senses on a child. Right around the age of about 3 to 4 months, a child will start to really be aware of the hands and will be able to start grasping a finger or even a very, very light toy. So this is, you can buy a set of these rings, and they're like tactile rings. They have little bumps on them, which are also for teething, different colors. They're also really nice because you can separate them and a child can actually hold them at about 3 or 4 months of age. A child should also be in a position where they can start to bring that item to their mouth. You also want to especially put a lot of items in a child's left hand. Many children are right-handed and will start showing a right hand dominance very early. But if you start putting things in the left hand, it'll give them more awareness of this hand, and they may end up starting to transfer that item over to the right hand by about 4 to 5 months. So these are very important for the hand development, the finger development, and also for hand to mouth. They're also great for soothing, and they help with development of breaking the teeth. They have little bumps all over them. Some of the parents may think these are too hard for the child to chew on, but they are not. Children will bite hard enough to soothe themselves and not to hurt themselves, and they'll also use it as a gum massager. So separate these. You can also use them to hang from a carrier or something if you ring them together. So this is another way to start visually stimulating your baby. Is you can, if you have a car seat or something where you want to hang these rings from part of the car seat, you can use these and hang it on the car seat while the child is riding in the car. There's no danger. They're going to be able to grab that and stimulate themselves. A lot of parents get very distressed because they may not be able to comfort the baby while they're driving because the baby's in the back middle of the seat. This is a nice way for a baby to comfort themselves because they will start to be able to bat at this toy right around 3 or 4 months of age. So you just have this attached to the carrier enough so the child can get to it. This is also a great example of a toy for probably about 3 to 4 months. It's a little larger, and it does take a little bit longer for a child to be able to manage a larger toy. However, it's small enough that the child can grasp this part. You don't want the handle to be too big so that they can't get their little hands around it. So this is more for like a 3 or 4 month old baby. Very early on, you can use little child blankets. This is like a sensory blanket, and actually this is good for any age. This is super soft. It's got some nice tactile input on the feet that a child can use later to teeth. It also has, if you can hear, it's rattly and crinkly, so there's a nice material inside that helps stimulate the tactile area, the touch, as well as the baby can hear the little sound that it's making. So this is actually a really good toy for a very small child, and it can also be used as a comfort measure if you have a child traveling. There's no way this child's going to be able to put it, over their head or anything. It's a very, very small item, blanket, and it's basically weighted extremely well, so it's just going to either be on their lap or in their hands. They also, many children will like the different parts of the ears and the hands and even the trunk to chew on. The other thing is, don't bother taking the tags off. The tags are something actually that children like playing with, so there's no harm in just leaving a well-attached tag. You don't have to take that off. Another little tactile toy are other little teethers that have bumps. These also can be real beneficial if you put them in the refrigerator for a short period of time, so they're nice and cool, and that's very soothing for a baby that's teething. Many times babies can teeth all the way from 3 to 4 months all the way till into their toddler years. So even older children may enjoy chewing on things for comfort, and that's okay. Even 12-month-old may enjoy chewing on something, and it doesn't mean it's developmentally inappropriate. It just means that they're trying to soothe themselves. It's very appropriate for a child to try to massage those gums as they're teething, and even they will use their hands if they don't have anything else. So these nice little bumps will help with the scratching and the massaging for the teeth to come out. One of my most favorite things to introduce parents to are bath books. So this is a kind of a weathered bath book, but as you can see, the more that you really wash and handle a book like this, the softer it'll get. So if you do buy a bath book, you want to start kind of really kind of manually moving it, and you can wash it. These can be cleaned off easily, and the older they get, the better they get, because they're very, very soft. They can chew on it, they won't tear the pages, so even the youngest child can enjoy looking at this and learning how to turn the pages, and also will start observing that there's little pictures inside. So it's very beneficial for children to start learning how to turn pages and to be looking at pictures. One of the other things that babies like are either books with very bright pictures or even animals. So this is a nice book for a little older child that's not necessarily going to be chewing on it all the time, but they may end up occasionally kind of putting their mouth on it. This is cleanable. It's also, you cannot tear this. So this is a book for probably about 6 months and up. It's great because it has nice large pictures and letters and words that a child can start associating a picture with a word. It also has one picture per page. You can work on naming the pictures and identifying. Children also really like pictures of babies, large faces, and animals. So this is a really nice book for anybody of 6 months and up. Some of the other items that are very beneficial are anything that is very tactile and very bright. This is one that also you can manipulate. So it makes a little sound as you turn it. So this is also a really good toy for probably starting about 3 months up. The child should get a little more directed on it by the time they hit about 6 or 7 months. The child should be able to manipulate a little bit more. So the older a child gets, you have more and more sophisticated play with the toy. So you should see them manipulate more and kind of check it out and see what it does and move it around, and that's what you want to see in child play. This is also a great tactile toy for a very, very tiny hand. They can start grabbing it probably about 3-4 months. It also has lots of different things to chew on. It's a very good tactile toy to have for travel and also for comforting. So as baby starts to teeth and things, they can manipulate, they can chew. You can also attach it. Like I say, you could put it onto the carrier, and so they can also grab onto it, and it's a great thing to have on a carrier so the child can kind of hang on to that and either hold it or put it in their mouths and comfort themselves. We also have some older toys that from the past that are still good. This is probably for more like 8 months and up or so, but you can also use the rings to start with. Eventually they should learn how to take the rings off and then eventually stack the rings on. So you want to start doing more cause and effect toys as a child gets to be 8, 9, 10 months. So some of the other toys that we're looking at are very tactile blocks. So this is an older toy that has tactile blocks that you can put together. And it comes with a container that a child can put the toys in, take the toys out. So one of the other skills that starts happening is first a child will dump toys out of a container. So any type of container you can use. I actually buy a lot of toys at secondhand thrift. We use chlorine cloths, bleach cloths, and sanitary cleaners to, really thoroughly clean the toys. But these type of toys are made very, very sturdy. They can be used for many years and are great to try to get at a better price. So this is a couple blocks that you can put together. You also, eventually the child will start to notice that there's things inside. You want them to start noticing the detail of, and even talking about, there's a bee in there and little animals. And so the older the child gets, you'll start to see them really start examining a toy and manipulating and working with it a little bit different. Eventually, as a child gets older, they should start to be able to stack, but the first part of it is they will take things off. So if I, for instance, at 10 months old, I stack a toy like that for a child, the child will come and take them apart. So they'll kind of learn the model of stacking. They won't be able to do it yet, but they'll start to take them apart. So that's kind of the first step on some cognitive or thinking skills, is learning that I can take these apart. Later on, they should, by the time they're about 12 to 14 months, be able to actually put them together and stack. There's a couple different blocks I have here. These are nice tactile ones with little animals, moving animals inside. We also have this really nice Lego table, which also I bought, I think, at a garage sale. And these are really nice stacking blocks. And the table was literally $5 that was cleaned off thoroughly. And now we have these really nice blocks that children can kind of learn and manipulate and stack. The very important thing about the difference between not using computer products and screen products is that you don't get that 3D image and feeling of a toy. Children need to be able to feel the difference between a circle and a square. So when they start to feel those items in their hand, their brain will tell them that this feels different than this does, and it will start to actually be pre-math skills. So they should eventually be able to learn how to stack, how to form things. You also have, by the child's about 12 to 15 months, you want to do a lot of form puzzle. This is a really, really simple form puzzle. What I do in the first place is I just keep the puzzle pieces there and just teach the child kind of to take them out, and then eventually the child will learn how to put them in. Again, when the child is able to feel the difference between these shapes, they're actually in their brain forming a memory of what it feels like to feel a circle and feel a square and the other shapes. If I just see things on a screen, I'm not going to have that registered in my brain the same way as I'm feeling things. So we also have some older toys here that are cause and effect toys, which are for toddlers, but actually you can use this pretty early on. A child will be attracted to the faces. This is actually quite an old toy that I probably had for many, many years, but many of these old products are very sturdy and really well built. And the thing I like about this toy is that it doesn't make too much noise. It's just a simple cause and effect toy. You open the doors, and the first thing a child will do is sit and kind of play with the doors. They eventually will be able to close the doors, and then later they'll start to be able to manipulate the buttons. This one being the easiest, and then later and later this one is actually a little more difficult because you have to have that movement. But these are really nice that they're very simple. If you do get a toy like this at the store now, it will usually have a lot of bells and whistles on it. The thing that I would recommend, though, is that you make sure that the sound can be turned off. You want the sound, you don't want a child to be overstimulated. So for instance, this is an older toy, but it has an off button. So for about 3 or 4 months, a child might be able to manipulate this and start using their fingers to manipulate these and kind of look at the colors. And so there's no sound going on. It's just tactile. Later on, you can let them have a little bit of the sound and music. But you also, if they start to become overstimulated, you're going to be able to turn it off. So this not only has auditory, but you can see it also has lights, which sometimes are not real necessary, but a lot of toys will have that nowadays. However, you do want to have an off button. Many children can get overstimulated by having too many bells and whistles going on. Overall, though, this is a good toy in that you have a lot of visual stim and tactile, and they can move these. And this will actually be entertaining to a child anywhere from 3-4 months on up to probably close to 2 or older. A lot of the cause and effect toys, this is an old one, which is really great too. It's just very simple, push, they move. So those are cause and effect toys, which are more starting around 8, 9, 10 months. They should be able to manipulate something and see something happen. So this is just really, really simple. You want children to really be able to use their hands and see how their play interacts with the environment. I'm not opposed to electronic toys, but be very cautious because many of them are expensive. This is a toy that I actually also bought at the swap meet. It's a nice standing toy because a child around 9 or 10 months can actually stand on this and kind of play. You can turn it off so that they're just, standing there, but you can also keep it on so that it has some music with it. The thing with standing toys is you really want a child to be able to manipulate and stand, but not necessarily to be in a piece of equipment that's going to limit their movement. Many of the walkers and the saucers and the things like that have to do with standing, they're actually holding the baby so that the baby does not have to use their own balance. This is a very simple standing toy that the baby has to be able to stand and hold their own balance and then go back down. So that's why some of the standing toys are actually better. So the baby just practices standing up and going back down, standing up and going back down. Many of the walkers, bouncers, or other standing devices will hold the baby so that that baby does not need to use their own balance in order to lower themselves or to maintain their balance. So actually I tell parents that many of the walkers and standers actually decrease the ability to walk. It impedes the ability to get that balance. If you have a child that's starting to stand, a lot of times what I will do is I will have the child stand and then just really gently I will let them go from here to there, from a piece of furniture to piece of furniture. So that's kind of the pre-walking with, say, around 10, 11, 12 months. Children usually should be able to get into the standing position by about 10, 11, 12 months. They're not necessarily walking at 9, 10, or 11 months, but they'll be able to stand and maintain their standing posture. It's still normal to be able to walk all the way up to 15, 16 months. Some children are very cautious and take a little longer to use their balance and are very careful when walking, but that's why they have to be given the opportunity to use their balance and not to be in a piece of equipment that's going to limit movement. This is an older walker that is actually very, very good at helping with balance because it has a very stable base. Some of the newer walkers, they don't have a real stable base. If you use a little walker, sometimes people will put a little weight on it in order to keep it from going so fast. But this on outside in a grass area or even on a carpet will actually go quite slow, and a baby can start working on walking. So right around anywhere between 12, 13, 14 months, babies now starting to take their first steps. I don't recommend many of the walkers, especially that have wheels on them, because baby is usually has access to a lot of items that they may not normally have access to, and also there's been instances where a change in surface can cause a child to topple over in a walker with wheels. So it's much better to have a closed area where you have a carpet or a real safe floor so that the baby can just get up and stand and use their balance before they start walking. Again, you want to always check with your doctor and have your doctor go over your milestones that's happening with the child, and if you're worried about your child, then get a referral to a therapist.